What's up, guys? It's Mrstlovely. I know I've been doing a lot of videos lately, but this one's important. So I hope if you guys watch none of the other ones, I hope you watch this one. It's actually a response to Little Miss Sunshine's band bashers, but it's also something else, and I'll get into that in a second. As you'll be able to see in the title, you'll know what it's about anyway. So at any rate, I just wanted to drop my own light on this situation. Even though she didn't really get into it too deep, but this is not the first time I've seen this, and I've actually had my little opinion on about it. My little opinion. Some time ago, I put a little bit of information out there, but let me put some more out here. Okay. Now, from her video, she was saying she went to a website, Obesity Health, OH, and she was just seeing how people talk about the band and stuff like that, and how people have their opinions. And you know, I think it's funny because most of the time, you guys know I'm nothing but real. Here's the problem that I have with certain opinions that are being voiced on certain forums or even on YouTube. You don't know anything. Period, point blank. You know, everybody has their opinions on different surgeries, and here's the underlying factor of that. Here's the problem: you don't know anything about it. How could you speak on something you don't know about? You know, and a lot of people they coin their opinions off of what the surgeon says. Period, point blank. Like I said in my other videos, the fact of the matter is some surgeons just don't want you to do the lap band because it's less money in their own pockets. And, you know, for some people who the surgeon asserts, I mean, I'm just being real. I'm going to be real with you guys. The surgeon asserts is not going to do work that looks at you like you're almost 400 pounds or whatever, however many pounds you have to lose. You can't possibly do all that. Because with the band, I'm not saying with the other surgeries you don't have to work, because I know some people that work. I know people in this form, or rather in this community, that have had all the surgeries. So don't get me wrong here. But with the band, you have to put the pedal to the metal. And I'm speaking from experience because guess what? I got a band in me. It's only been, what is it, 8.5 weeks now, because Tuesday will make 9 weeks for me. And I don't have restriction yet. I don't have a fill in my band yet. And let me tell you my own complications, because you know, you guys, I pride myself on being real and nothing else. My complications have been that my cycle has changed, but then again, with every surgery you have this possibility that your cycle may change because it throws off the hormones of the body. Your body has to adjust. So that's not really saying much because it's with any surgery. And I've had 2 surgeries. I've had my gallbladder removed. I had my gallbladder removed. I'm trying to ask my husband how many, but I think it was a year and a half, 2 years ago now. And then now I had the lap band surgery. And it's been 8.5 weeks, and I love it. I was just thinking this morning when I got up, I was like, I wouldn't trade it, because guess what, here, you know, this is coming from a person who used to have back pains, leg pains, migraines, spitting up stuff. I mean, waking up every morning with phlegm in my throat. That hasn't happened for 8 weeks. I'm losing weight because of my willpower at the moment, and you can't tell me, because the initial weight loss does help, and I said that before. But let me drop a little science on you as to the most invasive, not the most invasive, the most the worst thing that can happen, so to speak, for lack of better wording. And this is information that I found when I was doing my research, because I researched this thing for 5 years. It's not like I just woke up one day and was like, I want the lap band. No, 5 years. I'm not going to put all 5 years in this video. I'm just not. I just try to live out loud and show you guys through my journey what I've learned and all that stuff. Anyways, but here's the worst thing I've heard, which is band slippage. Now, you understand the commonality of it once I finish here reading, so you guys endure me for a second. But what is lap band slippage? One of the long-term complications of lap band surgery is called lap band slippage, and can be defined as when the lap band and the stomach pouch are both prolapsed. This means that the lap band has shifted position, and the enlarged stomach pouch has also shifted or twisted so that the food does not go through the lap band into the rest of the stomach. This may result in pain, discomfort, decreased appetite, and inability to eat or drink, and vomiting. Lap band slippage does not happen immediately, but may take several months to develop. Okay. Lap band generally develops in a progressive manner as food intake is increased. That means if you're eating up the world and you know you shouldn't, you're pushing to the limit, this is why this can happen. The stomach begins to stretch and grow, and the patient may stop losing weight or start to regain weight. At this point, patients may only exhibit an enlarged stomach lap band pouch. This can be medically treated by deflating the lap band so it can be fixed to release pressure and slow growth of the pouch. Successful in 70% of the cases, or surgical treatment can be considered. So 70% of these cases, if it happens, have been fixed, basically. However, if the enlarged pouch continues to grow, the lap band progressively rotates until both the lap band and the enlarged pouch become prolapse, resulting in lap band slippage. This is followed by a functional stenosis, narrowing of the stomach. A little bit more here, you guys. Lap band slippage symptoms typically include progressively worsening reflux, vomiting, and epigastric complaints, which may be increased in sudden near total dysphagia, inability to swallow, or anything including saliva. Risk factors or causes of lap band slippage include surgical technique. So whichever surgeon you get, you got to be careful because a lot of people are doing these nowadays. Model of the lap band used. So there's a few different models out there. Early consumption of solid food. So if you're pushing it too early in the band, you know, trying to get things in before you should, not following your surgeon's rules. That's what the point, to follow the rules. Early inflation or filling of the band, consumption of getting fills too early, consumption of carbonated or sparkling beverages, and frequent vomiting. You shouldn't be drinking soda if you got a lap band. You shouldn't be drinking carbonated beverages, period. You know, crystallized water, whatever, with bubbles in it. Treatment for lap band slippage requires surgical intervention. The lap band must be repositioned or removed based on the operative findings and condition of the stomach pouch. If operative, the surgeon and patient may elect to choose another type of procedure. In order to decrease, now this is what you can do to decrease this, the risk of developing lap band slippage. It's important to follow the recommended diet, like I said, following surgery, and to avoid introducing solid foods too early. In addition, the fills should not be started before 6 weeks post-operatively. Now, this has changed because some people get their fills a little bit earlier, depending on their surgeon. In addition, the fills should not be started, for 6 weeks, and should be very gradual. We also recommend the fills should be done under fluoroscopy. Now, what fluoroscopy is that the doctor can see the movement of the fluid going down into the stomach, so they know that it's not too much of a restriction, because if you're too tight, that can be a problem as well. Even if you are asymptomatic, to be able to monitor the position of the lap band and the size of the stomach pouch and the condition of the esophagus. This will allow for early diagnosis of any enlarged stomach pouch or possible lap band slippage. Okay, I know that was a lot. I know I talked really fast, but these are the things that can happen. But see, they come, like I said, from not small things, depending on the surgeon, because you can't, I'm sorry, you have to know your surgeon. Like I said, research, know his background. Like I said, know how he looks and know how he looked, know his years of experience. For me, I know what school he went to, and everything else. And you can find that in my other videos. Anyway, I haven't had any complications except for being sick due to my menstrual changing. That's it. But the improvement on health has been far outweighs that minor difference, or rather change in my body hormonally. Okay, and there's a lot more information. So for this reason, if you still tuned into this video, God put it on my heart. Actually, I was looking at the book this morning, and I've actually showed this book before, but I'm gonna go ahead. I want 2 people that are considering lap band surgery. Now, if you're not, then you can go ahead and click this video off. If you skimmed over just to see this part, that's still fine with me, because I'm still gonna do it either way. I want to invest in somebody who doesn't really know much about the band and would like to learn a little bit more. And so I'm gonna do a giveaway. like I said, there's a lot of different information online that will confuse you, that will make you reconsider. And you know, everybody's so opinionated and telling you their surgery is better. My surgery is better. It's like saying my school is better. My this is better. No, get some information. Well, see, I didn't have this information, but I'm giving it to you. Okay, I had to research, and I put things together for 5 years, and then I went on good faith. But I want to invest this in you, because this is by 2 people, like I said, who've been successful on the surgery, and they have. I really hate making this video this long because I know people won't watch the whole thing, but it's very informative. So this is a really good book. I would love to read a couple things for you guys, but I'm already been on here a while, and whoever's blessed with it will have this information, and it's solid, it's honest and straight to the point. There's even information, like I said, in here about other surgeries, and I also want to invest in somebody else, so I'm giving this one away too. So there's 2. So I'm going to do it the same way I did my other giveaway, except this is just, it's a spare of the moment thing, and it just got laid on my heart to do it. It's funny that this video came about. So I hope that this video helps somebody. I hope you have a little bit more information. Don't be afraid. Band slippage will not occur if you do what you're supposed to do. And if you do have signs and symptoms like now, so the vomiting, you can't, if that occurs, you do need to go see your surgeon. So you guys can rectify that situation and find out as to why it's occurring. Okay? And just a little notation. Yes, 2 months out or not, I learned this stuff. I educated myself. Don't let somebody else educate you. You educate you. So like I said, I am going to give back to you guys. And I mean, look at her. This is a surgery you can be successful. Not easy. I don't care what surgery you get. It's not easy. Period, point blank. So I'm gonna leave it here. Please leave a comment in the comment section below. I will put the authors' names and the name of the books in the description box. All right. I will talk to y'all later. Little Miss Sunshine, a little personal note to hear you here. You keep on considering, but I hope that you will enter here, and hopefully you'll be one of the people, because it can be done. People lose 200 pounds. People lose 300 and 400 pounds. Well, 1 and 200 and more than that. Just all depends on how much work you're ready to put in. So anyway, you guys, for those of you guys who want this book, I will be selecting a person randomly. Please enter your name in the comment section below. Like this video if it was informative. Talk to you later. Bye.